Excellent, and welcome to the TAD Summit online conference. I am really happy to have RJ here, a friend for many years, all the way back to a conference, all the way back in, well, actually, it was before that conference because we knew each other through sort of Troppo and all that stuff. But it was just when I was like, RJ was there, as I was seeing basically that conference. But anyway, you did a big announcement around Consig and you're getting focused around healthcare. So I'm really interested to understand what you're doing and how you're applying AI, voice AI, in the healthcare industry.
No, thank you, Alan. No, it's certainly no stranger to the communications industry, and I've really enjoyed it. The conference I think you're talking about, I think it was actually almost 3 years ago now, when you had the one up here in Portugal,
That's
where we
right.
met.
Yes,
I think next month it will be 3 years, and that was sort of that conference was actually my toe tipping back into the world of telecom communications and voice because I had kind of tried to escape it for a number of years, but just like you can't get out of the family. Just when you think you're out, they pull you back in as
exactly.
go with
Well,
it.
as I
So.
keep saying, communication is fundamental to the human condition. There was fire and then there was telecommunications.
Maybe not telecommunications, but speech certainly was an early
Yeah.
element of it. And, I mean,
Yeah.
and this actually, I mean, this goes back to, some people ask me like, well, why do people want what you, why are you doing voice? Is that really going to go through? And I fundamentally think voice is such a core element of how we communicate as
Yeah.
people. Uh, to me, the exciting part is the technology is finally approaching the spot where we can start doing it and it's not awkward.
Yeah. A
I grew
clunky, geeky
I
thing that a few people use. It's massively
yeah.
fun.
Yeah, no, so I mean, I grew up probably like many of us watching Star Trek, and where speech was how everybody interfaced with the computer as a
Exactly.
primary. It wasn't the exclusive, but it was just integrated naturally into the communication. That was always my goal. Now,
Hmm.
as a kid, I was one of those geeky kids. I actually had a Mac in the 90s. I had set up Mac and Talk and I could speak to it. And I thought it was
Yep.
fun, but it was
Yeah.
terrible. It
Yeah.
didn't really work.
Hmm.
Uh, and actually, that's been the part that has been fun is finally now it actually goes through it. I actually probably now compose 80% of my emails now in voice.
Wow.
Almost all my documents are
Hmm.
transcribed that way
Hmm.
because it's finally now made that breakthrough. And that, like I said, it's changed how I code. It's changed how I write.
Yes.
For me, actually, it makes my life so much easier. I'm a horrible writer, but like, well, I've actually this goes back to as a kid. I hated writing when I grew up. I was homeschooled.
Hmm.
My dad had gone, had gone through Catholic school, so he learned how to write cursively, and I was
Yes.
going to have to learn to write. I hated it, and that was my rebel piece. Is I like refused to write, and then it kicked me in the butt later on
Yeah.
down my years. I was like, oh, dang it, why'd you do that? Anyway, I digress. We go sideways. The hamster holes run deep some days.
That's it. But Consig, what's it about?
So when I started Consig about a year ago, I came into it knowing that it was going to be in the voice domain, but we had not picked an industry.
Yeah.
And we started building out a platform. We built out some first customers. Actually, our very first customer was in the healthcare domain.
Hmm.
And actually, all of our customers have been in the proactive communication and outbound domain. So
Understood.
this was where we started to build our technology base around. And as we got into it, we started doing a lot of market research and we started with okay, what are the domains that can be the most impacted
Hmm.
and improved with the technology?
Yeah.
And one of the reasons healthcare came up really as it came down to is as I started talking with people in different industries, it really resonated that healthcare was actually an industry where I'd say voice AI could be deployed not just to save money, not just to make doctors' lives easier or save a health insurance company money. Because, okay, to be honest, that's the downside of what I've been building all these years is most of it gets built to be in front of a call center and keep you from talking to people.
Yeah.
The interesting thing we found in healthcare was that it actually has the potential, A, to improve the patient side, because listen, health communication in healthcare sucks. I don't know, especially in the US. I have a little bit of a unique view because I have experienced it heavily in the US. I've
Hmm.
a daughter with special needs. I've gone through a bunch of stuff there. I live currently in Portugal, so I've dealt with the sort of more of the European style system, and I've dealt with Brazil, because my wife is from there,
Of
and
course.
we've gone there for a bunch of months. And the contrast in how communication works in these different countries is
Yeah.
shocking. Now, I'm not going to go down the path of saying what is better, what's the right model.
Yeah.
Trust me, that's too complicated of a problem for any one person to figure out.
Yeah.
I do think the U.S. has some of the best healthcare, but my God, is it expensive?
Yes.
And you are, as a patient, so insulated from the doctor. This was probably one of the biggest things I saw as a difference is the communication time you have in the US with a healthcare provider is so limited. You get 5 minutes with a doctor when you're lucky.
Yeah.
It's in, out. And God help you if you forgot to ask a question. Nobody is going to ever follow up with you. You're left kind of to yourself and the wolves to figure
Yeah.
it out. And this was the domain where I said, well, wait a second, maybe we could actually improve this process.
Hmm.
One of the biggest things I saw was the opportunity for follow-up.
Yeah.
When I go to the doctor, nobody ever checks on me. Did I do my labs? Did I do my
Yeah.
exams?
Yeah.
What does that usually mean? I only actually remember when I have my next physical and they asked me and said, so did you do this, this, and this in that
Yes.
5 minutes? And I'm like, no. And they're like, but why didn't you do it? Well,
You
I
told me and I
forgot.
forgot.
I'm a human. This wasn't good. So why can't we shift that into being something where there's follow-up, there's
Yes.
checks in,
Yep.
and not just reminders. I mean, reminders have been around for a long time,
Yeah.
but actually, this is a spot where I think voice AI can be helpful because, Alan, did you go and get your CT scan done?
Yeah.
No, I don't remember. What do I need to do to prepare for it? Well,
Exactly.
okay, this is what you need to do. You need to make sure that you've taken this medication, you've eaten this, done this. Are you going to be ready to go through that? Okay, yes, that's going to be, your
That's
schedule for
it.
tomorrow.
And that
Those are the,
specific problem is the one that my wife had. The doctor mentioned in the conversation they had, oh, yeah, she did mention that, but follow up. She didn't follow up. There wasn't an action plan. And as a result, it falls through the cracks. So I've experienced that personally when my wife had that mentioned. So that's a great example.
it is, I think, a universal thing. And here's the thing. It's not the doctors don't want to. It's not that
No.
the nurses don't want to. They have so much administrative work on their
Yes.
plate.
Yes.
In the US, for every hour of clinical time, there is 2 hours of administration time for a
Yes.
healthcare professional.
Yes.
They just can't, they're juggled, they're overloaded around this.
Yeah.
And what we started feeling was at Consig is, well, let's build voice AI to help for those portions. Now, the interesting thing is, where everything I've built in the past was all about automation and solving it in automation. Actually, the voice agents we've built, the best outcome, they're effectively their top success criteria is that they connect you, the patient, to a provider around that.
Ah.
So that in many cases, what we try and do is do as much of the administration work. Let's get your information. Let's verify
Yeah.
your identity. Is this really Alan, or did I
Yep.
call Alan's son and I start telling Alan's son some things that wasn't supposed to be shared?
Yeah.
So working through that administrative side,
Yeah.
and then listen, when something's important, we actually should connect you to the nurse or to your
Yes.
doctor.
Yeah.
And actually, that's actually been the fun part. All of the applications running our platform so far, that's a successful outcome for it, is that we
Great.
did a triage, we got some of the administration stuff, and then we successfully connect to a provider on the other side to have the clinical conversation.
Yes.
Because I do think, this gets into a whole portion of regulation. I think clinical care is definitely something that still does require human touch. It does
Correct.
require human compassion. I think AI can help. I think it's going to help. It's, you're burying your head in the sand and saying it's not going to get used in a clinical
Yeah,
scenario, but there's a lot of rules. Actually, it's
exactly. It has to
great.
be compliant. That regulation is to protect basically everybody in the ecosystem.
So right now, we've actually been leaning into this very heavily because we realized how much, especially in healthcare, this comes up. Right
Yeah.
now in the US, there's 550 different regulations and laws around healthcare and AI that are being proposed, that are working their way through this different state law environments.
Yeah.
Many of these conflict. I'll
Yeah.
give you an example. In Utah,
Hmm.
if you are using a chat bot or a voice AI bot, it is required, and I think this is should be universal, that if it's asked if it's an AI or artificial intelligence, that it responds
Yep.
affirmatively. And
Yep.
I fundamentally think that's one of those things that should be universal across this.
Yep.
Now, the thing is, if it's clinical and you're actually having a clinical conversation in Utah, you need to get affirmative consent from Alan before you can actually even have start any of the conversation.
Oh,
So actually, as part of the conversation, you need to make sure that you've gotten an affirmative, yes, you're okay working with artificial intelligence. Now, think about how all the different rules around how that applies.
yeah.
When does it cross into clinical? When doesn't it? And it's
Yep.
going to be a different set of rules in Georgia, a different set of rules in Florida, a different
Yep.
set of rules in California. So what we've started working with is starting to map those things out
Gotcha.
for healthcare, is building those assumptions into the technology that we built.
Yep.
Because the first thing one of the interesting things we did is we actually got accepted into the plug and play healthcare accelerator, which was
Oh, yeah.
so helpful. The
Congratulations.
guys have
That's
been
great.
great. They launched it in Orlando, which was our home court, so which was yeah, has been really nice as well because we can just kind of drop in there and work with us. But the piece that was so valuable about that is we got time and face-to-face collaboration with a lot of the corporate sponsors. So we start working with GuideWell, which is the Blue Cross Blue Shield
Yep.
of Florida. And we were able to get assigned a great mentor who really knows the inside of the system. His job is kind of to be a startup, effectively a liaison to
Yeah.
help startups sell and understand what it is. And we've had some great sessions with them where they've talked through very openly, like, here is what we're concerned about with AI,
Yep.
why we're concerned about it with AI. And listen, if you're going to sell us anything with AI, because you're going to sell us stuff with AI, here's the things we need to understand and go through
Gotcha.
it. Our procurement job is going to say no.
Hmm.
100%, when you walk
Yep.
into procurement, the contract you're going to get is going to say you're not allowed to use any AI whatsoever.
Hmm.
Full stop, done. They're like, that's actually not really what you're going to end up having to do. You're going to go through it, but we need to understand how it's getting used. And
Yeah.
are you actually using the AI appropriately for where it is in there? And this has really shaped our approach
Yep.
because, and this goes into it, everybody right now wants to sell AI everything.
Yes.
And first of all, 80% of it is just marketing bullshit. I hate to say,
Yep.
sorry. I'm not sure if I can say that, but it's
You can
the
hear.
bullshit side is not there.
Yeah.
A lot of it is marketing. And then you have a lot of things that what do you consider AI? I
Yeah.
mean, we have things that were just frankly algorithms. Is that
Correct.
artificial intelligence? But that's been how it's been used for years.
Yeah.
Speech recognition. It's a data trained system. It's worked that way since forever.
Yeah.
Is that no? What you really find is that it's many, many shades of gray, and it goes
Exactly.
through. And what really has come down to, and been for us, a strategic differentiation is we look at applying, I call it the right amount of the AI for the problem. So
Gotcha.
we're in a we're building voice automation.
Hmm.
Let me give you an example around that. Do we need an LLM running the conversation to verify Alan's identity, to get your payment information, and to work through an intake form? No.
Yeah.
That's actually, frankly, LLMs and the current generation generative AI is not a very good solution for that. It
Correct.
goes it's non-deterministic. Now, true, it's very flexible, and we'll talk about some of these cases where it is in
Yep.
there. But for identity verification, that's actually where we want to use directed dialogue. I
Exactly.
know our touch tone, I mean, DTMF, if I'm getting a credit card number from you, is actually a much better way to get that in there accurately around it.
Exactly. Yep.
So we put
100%.
those in for that portions of it.
Yep.
We use intent mappings because guess what? That actually works really well a lot of times where you're
Yep.
trying to map it into, I'll call it particularly when it's semi-structured data. If
Mhm.
you only have so many choices to pick from and you don't want to have everything,
Yeah.
you do need to map it into specific intents.
Exactly.
And then if I'm going to go do something like scheduling and say, Alan, when do you want your appointment? That's a beautiful thing for an LLM. That stuff
Exactly.
we tried to do that stuff with directed dialogue. It's horrible. It's a miserable experience, but that can power through it. But guess
It's
what?
certainly, yeah.
That portion of the conversation doesn't need access to your PII. It
Correct.
doesn't need your diagnosis codes. All it needs to know is Alan needs to make an appointment
Yeah.
with a doctor name, doesn't even have to know what the doctor type is, can have a little
Exactly.
bit around that. And
Yeah.
we do what we call it context firewalls. The LLM never gets any of your PII.
Yep.
The directed dialogue had access to it, but really only in the segmented portions around it. So this has been
Perfect.
the way we've approached it.
Yep.
And it's been, like I said, that really has helped us out in healthcare. It's become a strategic differentiator for us
Hmm.
compared to folks who maybe started pure LLM
Yeah. Yeah.
domain. Because guess what? These are older technologies, but if you look back as a gray beard and balding guy, some of that is actually pretty useful.
Yeah.
There's some good
It
lessons to
makes
be
it
learned
easy
about
to
what works
lock
with this.
it down so you can keep
Yes.
it within the constraints that the buyer wants the solution to be held for. So, yeah, fully agree.
And
And go for it.
that's exactly what we've been putting together is
Gotcha.
then when we build some of these workflows that can be
Hmm.
adapted. And
Yep.
listen, some of our customers want it fully generative. They want the super fancy, flexible experience. And great, we can do that.
Yeah.
Other folks, they have contracts that say they can't have any generative.
Yeah.
So we put those into a directed dialogue and intent-based approach. And it's just
Exactly.
knobs and it's basically the policy pieces around it that changes those out
Yeah.
based upon the risk, the type of domain that you're going in. Like I said, I use that Utah example. If we're just doing administrative tasks, scheduling payments, great. Those things were wonderful for it. We
Yeah.
don't need consent. We have a really easy way to go through it. When we do get into clinical, now we got to make sure that we actually have an explicit workflow,
Yeah.
that it's audited, it's tracked, and that yes, Alan said yes, it was okay to have that conversation.
Cool. That's great. So where is Consig at the moment? You've got the sort of hackathon, or the sort of piece you were involved in. Are you raising cash? Have you got channels to market? Just interested to understand, where you're
Yeah, so we've
on that
got
scale up phase.
Yeah, so we've got a good handful of existing customers running live on the platform
Cool.
today. So we're handling millions of patient conversations already a year, which is a great
Cool.
spot to be at.
Yep.
We have bootstrapped this far.
Yep.
I think as a founder, especially at the very early stage, it's painful, but it's very useful to bootstrap it and get a real understanding of what customers need and what will they actually pay for.
Yeah.
We are at the spot now where I think it is time to go ahead and scale because we haven't had any go-to market. It's literally just
Yeah.
been me selling, going through it, and actually it's been very proactive, reactive, not proactive on the outskirts.
Yeah.
But at this point, now that we've got a core product, we've got a couple things that are reproducible, because that was the other piece is that, I always say you want to make sure that you're not just selling a bunch of projects, but is there actually a common thread? And that's where we feel that we locked in because all of our customers are doing the
Gotcha.
same flow. It's running the same platform. It's solving the same problem. Now, the difference might be different if we're calling for a health insurance company versus calling the dentist office.
Yes.
They use different languages,
Yes.
but it's actually the same flow and what we were able to build on top of that. So
Gotcha.
we are kicking off. We're going to I think it's time to do a fundraise and put a little bit of fuel in the tank around some of this.
Cool.
Hopefully have some fun announcements around coming down the pipe soon around especially the go-to-market side. Having a lot of conversations to bring a couple extra folks that could really help us get to the next step.
Ooh,
I think
oh,
that's
that'll be
going to
exciting.
be one of the fun. That's going to be the spot. Is you gotta bring a great team. Thankfully, I've had a wonderful network of folks I've been able to work with over the years. And TAP been that's actually been one of the best portions is the network I've been able of folks that have been able to come help us and learn about this stuff. That's been the fun
Cool.
part.
That's exciting, exciting, absolutely. So specific needs, I mean, because you're here, I'm sure you've got worries, concerns, there's people you're trying to chase, maybe even in particular regions. Just, let me know, let's the
No, no,
viewership
it's
know
okay.
what you're after.
Absolutely. I mean, we are focusing, we are trying to focus down from region and places around that. I always say when you start a company, the sky's the limit. You can go do anything. And your job each step of the way is to get it more and more focused down on
Yeah,
the use cases and with that target customer. And healthcare has been part of that process.
yeah,
And we feel we've got a pretty good latch on. Uh, we definitely are about to start some of the next round of trials and technology partners.
okay.
I come back to it is our team's DNA has had a lot of success being, I'll call it enabling technology,
Hmm.
helping effectively being a component to power voice interfaces. That's what we did at Voxeo. That's what we
Yep,
did at Tropo. That was
yep.
always kind of our approach was we'll be the telecom geeks so you don't have to be.
Hmm.
And we powered, millions and millions of healthcare conversations, school conversations go through it where it was always embedded in it. I think we want to go with a similar approach here in healthcare. So we're looking
Okay,
for our next set of partners, things like the EHR some of the EHR vendors. There's a lot of folks that we're working
okay.
with on that side to add voice AI capabilities to the workflow. Because this is actually one of the things that's really, really important, especially talking to the clinicians. They
Yes,
have too many tools. They
yes,
don't want to learn a new tool. It needs to work inside the systems they already have and
yes,
surface around it. Uh, no extra planes of glass to go log into, no portals, please. That's
yeah.
like the first piece around it. So that really affected how we've thought about go to market, how we strategize partnering with folks around that side.
Gotcha. Understood. So it's really looking for partners that are embedded in now. Are
In the
you
healthcare
looking
space,
in a healthcare space, but what specialism within there? I mean, is it like primary care? Is it a specialism within there, like imaging? I'm just trying to
so
get a feel for,
For
maybe
us,
some.
for us, like I said, we look at it as being ideal partners being in the ancillary, some what they call it ambulatory care or kind of ancillary care areas like dental,
Yeah.
OT,
Yep.
home healthcare.
Gotcha.
Those areas have a lot of communication channels,
Yes.
and we see that that's kind of a good place to go into the market. It's more, if it is, the challenge you have is the hospital systems are, to be honest, they're slow buyers.
Yes.
They're very enterprise. And we certainly can sell and go into it, but one of the big pieces of advice we had from a lot of folks in the healthcare space was like, don't try and start there. It looks
Yes.
tempting, but it's going to
No.
be a very long process to go through it.
Exactly.
Work in a lot of these edge cases, build a good, make sure the solution works, and then you can kind of go in and tackle those places, and you'll get pulled into it anyway. Some of your customers are going to take you there,
Yeah.
but
Understood.
really go build an execution. So dental is a key one for us. We see a lot of potential there.
Yeah.
We've got some great partners that we're starting to line up on that side.
Yeah. And just as a patient, I look at, well, the, Summit Health just up the road. You know, their use of technology is, you know, I mean, you log in and it does all the identity confirmations. And oh, we notice you've got a bill. Oh, there's a charge. And then, oh, why don't we confirm that? While you before, and the other thing that I love is it allows messaging to all your doctors. So you can choose the doctor and you can message them. And, it's like I just finished the antibiotics for the Lyme disease that I've been treated for. And then it was like, hey, I'm about to finish. Here's the outcome, and it's just lets the doctor know and gives them the opportunity to say, oh well, we need to follow up and do X, Y, Z. To make sure it's really gone, Alan.
there really are some places that are starting to finally go through it, and we do see what I do see is that particularly some of the hospital systems and some of the caregiver systems do want solutions on that. They're looking
Yeah,
for pieces. It's just technology is not great there yet.
yeah,
There's still the barriers that the rules and regulations, it's a shame because on one hand, it'd be nice if you could text and not have to log into those portal and messaging systems and you could go through it. But there is a lot of reasons why they need that. They need the audit trail.
exactly.
Need to
Name,
know
date
that.
of birth. Yes, that's me.
Yep.
And you can see there's a regulatory for identity verification you must
This
use.
is this is a big portion of what a lot of the capabilities that we've been adding into it is being able to, for example, integrate voice biometrics, both voice,
Oh,
facial,
yeah.
fingerprint into the authentication flow of a conversation. So this has been one of
Oh,
the things that we've been going through. It is great. Alan, can you look at your phone? You're going to get a secure link.
yeah.
Authenticate using a passkey on your device.
Yep.
Then it's all device-based authentication. We're able to verify that it went through that flow without having to send your face off to the cloud and be kept in
Exactly.
whatever
Yeah.
system in there. So
Cool. Oh, that's really exciting.
it's the fun. Those are the fun toys that we get on the product side to go start playing with and put together. So.
Cool. So what's coming up in the next 6 months? I mean, sounds like everything's about to change as you scale up the organization.
No, I mean, I think like I said, we're starting to build and find the right grow the team. It's getting the right folks in.
Gotcha.
And we've had a separate piece. I do think scaling and building an organization right now is very different. I'll actually
Yes.
say, the hiring and bringing folks into the team. I think we talked a little bit before about this of,
Yeah.
on the one hand, there is a lot of companies doing huge cuts because of AI. It's in the news here and there. And I
By companies
actually
that are
think,
selling II. I mean, that's the key we need to look at. They're
yeah, that's it.
because they're trying to sell it.
I will say, I think, especially for small companies, this is probably an opportunity to be able to get some really good people. I do think, you know, if you're looking to come into this space, I think it is tough to come in at the junior level right now.
Yeah.
I see the team dynamics of what you're wanting to mix, how I'm looking to hire into the team has changed.
Yep.
The scaling up an engineering team doesn't look the same way now than it did a year ago.
Correct. Yep.
And to be honest, it's going to look different in a year from now as well around this
Yeah.
side. So this, to me, is where I really value flexibility and adaptability
Yeah.
for who we're going to bring into folks that can apply themselves to different domains and quickly adjust to the processes as it moves around, but have the industry experience of going through and knowing what doesn't work and what does work
Yeah.
as you grow a business. It's very, very different. What you need to do when you're running a couple $1 million of sales versus $10 million of sales to $50 million of sales is a very different process. You
Yes.
need to think about how you scale and set up the foundation at the beginning. This is one of the pieces
Exactly.
I've gone through, having gone through it several times. There's things you can do at the beginning that make your life so much easier down the
Yep.
road.
Nope. Wholeheartedly agree with that. It is a big issue. And it's from those first few deals where everything's handcrafted to, damn, we need to make this reproducible. And you've got that millstone around your neck. Why did we do it that way?
Now that has been one of yeah, like I said, that is definitely one of the things that when we've been building stuff, we've made a lot of assumptions that everything just is going to be changeable. And
Yeah.
it does, that is actually one thing I'd say AI has made it a lot easier to do some of those types of changes,
Gotcha.
long as you've put in the right architecture with
Yeah.
the right infrastructure, that those are easy to change out building blocks on stuff. So
And we were having that conversation on another podcast.
yes, indeed. So
To your point. So cool. Now, this is really exciting. I'm so happy that Consig has got to this point, and really, I'm looking forward to following your growth trajectory.
no,
And
I
I was
appreciate
just covering a podcast we've got coming up in next month with Voxist, and they are in the voice AI space, and we've covered them all the way back to 2009, where they were at the conference that you and I were at all those years ago. But
I remember ecom, and those were fun times. Those fun.
but it's so funny. I was looking through all the people that were attending, and like the founder for Ring was there, and of course Jason Goecki, who we'll be chatting to soon. But it was so funny. There was this group of people, and some of them become very successful. I mean, billionaires. While for the rest of us, hey, we've made a mark, and we're happy doing that.
No, that is true. Like, so some of the stuff I'm most proud of is that where we've been able to make and shape the industry. Maybe
Yeah.
we didn't always make the biggest absolute impact, but we laid a lot of the foundation along the way, I feel like. So
Exactly. That's it. We helped build it. So cool. No, this has been so fun, RJ. Wishing you the best of luck. We'll be tracking you and helping promote everything you do. So again, well done. Looking forward to 2026 with Consig.
absolutely. Thank you, Alan, and thank you everybody for joining in. So
Bye bye.